My name is Rosie Bartel, and I'm a wife, a mother, a grandmother, and an educator. And during the last 5 years, I became a person who received a MRSA staph infection through a knee replacement. And so now I'm looking at how did this happen to me, and how can I make sure this doesn't happen to a lot of other people. If you were going to have surgery tomorrow, next week, or next year, you need to look at these things. You need to look at making sure your hospital follows all the rules that hospitals should be following. And then you need to ask, how are they warming their patients? You need to ask that question. That would have been a question that today I would ask. I would ask what kind of warming units they use. And I would make decisions, I think, on that today. Because all of the other things are pretty much standard across the hospitals. They're being monitored very closely on those things. There's government agencies that monitor hand washing and all those things. But the warming units is an option for hospitals. They have an option. They can use one of two kinds. And so, if your hospital's choosing to use the forced air warming, maybe it's time to look for a hospital that doesn't use that. I know there's hospitals across the country that are using the conductive fabric warming. And, today I wouldn't go to the hospital I went to for a major surgery, for an orthopedic surgery. I would go to a different hospital. And that's the question you need to ask yourself. What kind of things do you need to look at? Look at the research that's offered in this video. Look at it. Don't take my word for it. Do your own research. Because the research is out there. If you Google, forced air warming, you will come up with a ton of articles, pro and con. So don't be afraid to look at the research and then make your own decision. But don't just say, well, that's what they're a good hospital. They know what they're doing. They only have a 0.5 or a 0.01, rate of infection. Remember, you don't want to be the 0.01. I didn't want to be the 0.01, but I didn't know.